Today's video is on atropine injection, its indications, dose, route, mode of action, side effects, and contraindications. Let's see. Indication and use of atropine injection. Atropine injection is primarily indicated for bradycardia, that is slow heart rate, to increase the heart rate. In organophosphate poisoning, to counteract the effects of certain types of pesticide or nerve agent poisoning. During pre-anesthesia, to reduce salivation and secretions during surgery. Antispasmodic, to relax the muscles in the gastrointestinal tract. Now let's see. Dose and route of atropine injection. In bradycardia, adults' dose is 0.5 mg IV every 3 to 5 minutes as needed. Maximum total dose is 3 mg for pediatrics, 0.02 mg per kilogram IV, with a minimum dose of 0.1 mg and a maximum single dose of 0.5 mg in children and 1 mg in adolescents. May repeat every 3 to 5 minutes for a maximum of 1 mg in children and 2 mg in adolescents. In organophosphate poisoning, adults' dose is 1 to 2 mg IV or IM every 5 to 15 minutes until muscarinic symptoms are controlled. And in pediatrics, 0.02 to 0.05 mg per kilogram IV or IM every 10 to 20 minutes until muscarinic symptoms are controlled. In pre-anesthesia, adults' dose is 0.4 to 0.6 mg IM or IV 30 to 60 minutes before surgery. In pediatrics, 0.01 to 0.02 mg per kilogram IM or IV 30 to 60 minutes before surgery. Maximum dose, 0.4 mg. In antispasmodic, adults' dose is 0.5 to 1 mg IM or IV, and in pediatrics, 0.01 to 0.02 mg per kilogram IM or IV. Maximum dose, 0.4 mg. Now let's see. Mode of action. Atropine is an anticholinergic agent. It works by inhibiting the action of acetylcholine on muscarinic receptors in the smooth muscles, cardiac muscle, and glands. This results in increased heart rate, reduced bronchial secretions, and relaxation of smooth muscles. Monitoring of patient. Patients receiving atropine should be closely monitored for the following: heart rate and rhythm. Continuous ECG monitoring is recommended to assess the heart rate and detect any arrhythmias. Respiratory status. Monitor respiratory rate and effort, particularly in cases of organophosphate poisoning or when used pre-anesthesia. Blood pressure. Regular blood pressure measurements to detect any changes. Neurological status. Observe for signs of central nervous system excitation, including agitation, confusion, and seizures. Secretions. Monitor oral and bronchial secretions, especially when used pre-anesthesia or in poisoning cases. Urinary output. Assess for urinary retention, particularly in patients with a history of urinary tract issues. Now we'll see. Adverse effects of atropine injection. Dry mouth, blurred vision, photophobia, tachycardia, urinary retention, constipation, CNS effects showing confusion, agitation, hallucinations. Contraindications of atropine injection. It's contraindicated in patient with glaucoma, tachyarrhythmias, myasthenia gravis, unless used to manage side effects of anticholinesterase drugs, obstructive uropathy. Always follow specific protocols and guidelines based on the clinical scenario and institutional policies. Thank you for watching my video on atropine injection. And lastly, don't forget to like and subscribe to our channel for more such videos. Hope this was helpful to you. This side digital content creator, signing off for today. Take care, stay safe and healthy.